Welcome friends once again to our NPTEL MOOC module on health economics. We are in week number 10, that is unit number 10 on health efficiency. We have already started discussing on the issues of productivity and efficiency. What are the concepts of this? Even in the previous lecture, we discussed this in detail about various concepts of productivity and efficiency analysis and their relevance. And in this lecture, we will be sticking to data envelopment analysis. There will be couple of lectures on this. Otherwise, it is very difficult to give clarity on DEA, that is data envelopment analysis. It is highly applied irrespective of fields. We have already discussed in our previous lecture. Hence, our objective in this class are measures of economic efficiency, input oriented DA as well as output oriented DA, basic introduction to other model like SFA, that is stochastic frontier analysis. So, what is that DA etc. We will start with some definition and measures of economic efficiency, then we will can able to address it correctly. While understanding economic efficiency, it refers to optimal allocation of resources to maximize overall well-being or utility within an economy. So, it is related to actually optimal allocation to maximize the well-being people. This is used to assess how effectively resources are indeed applied to produce goods and services. There are two main components of economic efficiency, that is broadly called technical and allocative. We will be also evaluating and explaining you how to measure technical efficiency and what should be the coefficient in our subsequent lecture through the application of the appropriate software. We will evaluate and we will also emphasize what is the meaning of economic efficiency, which is jointly defined by technical and allocative efficiency. First of all, technical efficiency, it refers to the ability to avoid waste by producing according to the technology. So, given the technology, how maximum we can able to address. And whereas allocative component refers to the ability to combine inputs or outputs in optimal proportions considering the prevailing prices. Given the price, hence it is referred to the budget or the constraint. Given the constant function in the production function, how we can able to best allocate or combine inputs to have optimal outputs. That is all about the concept. So, the fundamental building block of the economic analysis of organizational efficiency is indeed the cost function or its counterpart, that is production function. So, either cost through optimization or production optimization are the two key important directions where we will be emphasizing. Koopman indeed in 1951 gave the formal definition, talks about producer is technically efficient if an increase in any output requires a reduction in at least one other output or increase at least one input. So, this means that technical efficiency, whenever we say, of course, we will emphasize increase in output, that is a function of reduction in at least other output. If we have other targets as well, if we have to actually reduce or we need to increase at least one input, then only we can achieve our target output. Okay. So, that is basically called technical efficiency. And if reduction in an input required, this is in terms of output which just defined. If our target is through input minimization or the cost minimization, this requires to define as technical efficiency or technically efficient, This requires an increase in at least one or other input. We need to we can able to reduce the input requirements if and only if we need to increase the input or a reduction in at least one output. If you can reduce the output, then I think we can be in a position to optimize our input requirements. Okay. So, that is basically called technical efficiency. That is the formal definition from the original source by Koopman 1951. There are other ways of defining technical efficiency by Debrew and Farrell. We have also cited in a previous lecture. They defined as input conserving orientation, largely called input oriented model, and second one is called output augmenting the orientation, that is actually fostering output. This is also called output oriented efficiency or technical efficiency. Then another one is called non oriented. Okay, we cannot even define if the already optimum level is reached and there is hardly any deviation, then in that case maybe define the third one. Now, starting with input conserving orientation, that is input oriented model. This is defined as maximum equiproportionate reduction in all inputs that is feasible with given technology and output, and this is usually identifying the radial distance. This is basically called maximum equiproportionate reduction in all inputs that is feasible with given technology and output. We will explain all sort of things in diagram. And this is also mentioned as keeping output fixed and explore the proportional reduction in input usage which is possible. How to construct production frontier and the technical efficiency measure we will discuss shortly. So, through this example, here is an example. Our input are given as x1 and x2 and output is y, and in this case there are 6 DMUs A, B, C, D, E, F, and here the output is already considered to be neutralized as 1. Our combination of x1 x2 that will lead to the maximum output possible, that is if any, will be defining our technical efficient point. Now, to find out the result, we will plot it accordingly in our diagram, but the first step is to understand through the input combination which you have taken proportionate to the target, that is y. So, hence we have taken x1 by y and x2 by y, and we will plot on the graph. Join extreme point towards the center represents minimum use of the inputs. So, extreme points means, so the all sort of combinations x1 x2 input 1 and input 2 we have taken by wherever the minimum possible basket is attached. So, we have plotted the line, the line that is actually in a position to define the minimum most combination, and however this also derives the output targeted as 1. Okay. Now, in this one we will be emphasizing on the technical efficiency, and that is simply defined as minimum input out of the actual input of the concert DMU. So, in the specific DMU, we will define as the technical efficient DMU by taking the minimum input, the less input out of the total or the actual input of concert DMU. So, we will just see how is it defined. So, like OP by OC is given, you can just have a look. Here is the diagram. In the case of C, in the C, that is the DMU C, you can see the input here is 4 and then x1 4 and x2 8, somewhere one we have plotted it a point of C. However, given the C, given the radiant of C, we could easily trace that the optimum or the minimum most input level is actually at P. Okay. So, hence we will define the OP. This is out OP by OC. OP, the minimum most distance, is actually here by OC. Okay, this is the one, and so OP by OC, and here we are actually calculating the distance. D stands for the distance. So the lowest is the case would be actually the better, and let us see the form or the DMU with best combination, and form or the DMU best in using the input 1 can be also calculated. So, and or the particular DMU which is actually using another input. So, wherever we can actually calculate the respective DMU with respect to 1 and with respect to 2. Okay. So, best in using input 1 and best in using input 2 can also be calculated. So, here once again we will also clarify through another diagram. At this stage we have simply calculated the technical efficiency of the DMU, that is C. Okay. In this diagram DMU C we have calculated, and then we will compare which one is in fact the best. Okay. In the now I will discuss something about output augmenting orientation, and that is also called output oriented efficiency model. Now this is defined as the maximum radial expansion in all output that is feasible. That means the maximum possibility will take with given technological inputs. So this will keep an input constant and explore the proportional expansion in output quantity that are feasible. And how to construct production frontier and technical efficiency? This case we need to assume in that case we have to take the combination of y1 and y2 and with a given level of input. Here you can just mark the difference that the x is no more considered to be constant. Now that can be variable as well. However, we can still find out the output augmenting technical efficient form or the DMU. Okay. So now let us see what is there in detail. So just the reverse we need to follow. We used to define as x1 divided by y in the previous case and x2 divided by y. Since it is output oriented, we need to now calculate as y1 divided by x with respect to an input. Input is this is with respect to x as a ratio we will actually find out, and then we can actually plot it accordingly. And then if since the output are actually more in number and they are different, we can normalize outputs to 10 inputs in this example. We can divide by 10 and accordingly calculate. Okay. In this example actually that is whatever the ratio we got it, and finally we have divided that with 10, okay, to normalize it. Okay. Now we will, and in this case we will join the extreme point away from the center that represents the maximum possible production. Okay. Higher the boundary is higher the best output, and that is basically called best practice frontier, alright, or also called efficient frontier. So technical efficiency in case of BDMU we can just find out like this: OB divided by OB star. So the maximum possibility is actually OB star, and OB is their actual one. So the technical efficiency of that case is OB divided by OB star. Okay, and then same distance formula is also as discussed. Okay, which we already discussed in the previous case. Third one is called non-oriented technical efficiency, where no radial adjustment is possible. It might be due to all DMUs are already working efficiently. Okay, so non-radial, non-oriented technical efficiency can be measured where no adjustment is actually required or possible. And this kind of understanding can also be extended to nth level. If there are m inputs and m number of inputs where we used to start with limited number of 2 inputs and 1 output, or 2 output 1 input. If it is m inputs and s outputs, then the production frontier becomes a surface in the dimension of m times s space. Okay. So, now repeating once again, we have derived in this case for the B form, B DMU is OB by OB star, OB star. Okay. So, mark the difference, and accordingly we will also calculate and compare each of the DMUs and find out which one is indeed the best. So, what are the methods of measuring efficiency, how people are working? Usually there are these structure followed. For economic efficiency, there are parametric method and non-parametric methods of measuring efficiency. Within parametric, there are frontier methods and non-frontier methods, and even in non-parametric method also the same 2 types are available. And in frontier methods, we have within the parametric structure we have stochastic frontier analysis. And in case of non-frontier methods, we have simple regression analysis, where since it is parametric, we will be deriving its parametric coefficients through the regression. And in non-parametric method, frontier analysis, frontier methods as part of the non-parametric analysis is called DA, where as you might have heard that DA is actually a non-parametric method. And as part of the frontier method, the borderline is mostly emphasized, the optimum level is emphasized, where DA is discussed. And the envelope of all the variables are discussed, how far we are involving, we are going to discuss in short a while. And non-frontier methods, where we will be using, or in case of non-parametric structure, we will be using index numbers. But however, we are not emphasizing all sort of things in our this module. We are emphasizing on the DA as per our proposed direction. So, DA we are actually emphasizing, as I just said. Now, then what is parametric? I have already mentioned. In econometric approach to efficiency measurement, we usually assume the function. Okay. And the function may be, the production function might follow Cobb-Douglas one, maybe constant elastic substitution method, or translog function, or maybe constant elasticity structure and transcendental function, etc. There are different assumptions taken. And then in cross sectional data, if you have 2 classes of econometric techniques available for efficiency analysis. One is called, in case of cross sectional data, some use as Coles, that is called corrected OLS, and then called stochastic frontier analysis, SFA. Okay. Even in cross sectional data also we can able to use this. Now, difference between Coles and SFA lies with the interpretation of the residual, and in Coles particularly the entire residual is interpreted as arising from inefficiency, and in SFA the residual comprises a mixture of inefficiency and measurement error. Okay. In case of non-parametric, as we already know that it does not have parameters, non-parametric piecewise convex isoquant constructed such that no observed point lies to the left or below to it, and hence no functional form, and this is based on best practice frontier. There are multiple inputs and output can also be considered. And this also provide information of slack and target. These will be discussed in our subsequent lecture. Econometric approach to efficiency measurement, we have to go by if it is parametric one, then we have already discussed such a while. So, accordingly, in case of cross sectional data, as I already mentioned, we have to take the help of Coles and SFA. Now, let us discuss DA as part of the non-parametric analysis, efficiency analysis. So, data envelopment analysis is most dominant approach for efficiency measurement, especially in healthcare and in many other sectors of the economy. As mentioned by this author, DA is actually a data driven approach. The location of the efficiency frontier really matters while understanding the DA. Highest ratio of output to input are considered efficient, and the efficiency frontier is constructed by joining these observations up in the input output space. Inefficient organizations are usually enveloped by the efficiency frontier in DA. So, whichever are actually inefficient organizations or the categories are actually enveloped together to derive results. Hence, from the frontier how far they are deviating can clearly be observed. DA uses the DMU, that is decision making unit, for each of the units of analysis, and a term was coined by this term was coined by Kans, Cooper and Rhodes in 1978 in their seminal paper which introduced DA. The DA can reflect a whole range of different labels in healthcare settings. The entire healthcare system comprising maybe comparing countries based, there are different works we have cited for your readings. Health regions or health district, hospitals, individual physicians, etc. On this DA can be applied. We have also discussed in our previous lecture. DA is examined in various contexts, such as assuming a constant returns to scale, production technology, variable returns, or even scale efficiency cases. So, in this lecture we will be sticking to CES function, constant returns to scale, CRS function. So, DA assesses efficiency in two stages. First, a frontier is indeed identified based on either those organizations using the lowest input mix to produce their outputs or those achieving the highest output mix given their inputs. So, it is basically lowest input mix to produce the target output, as we usually do. Q is a function of Q is a function of x, or where target is either this, maximize given this, or minimize the C, or maybe C, you can write down C here, C, minimizing C, function of level of Q. So, whoever direction we do, but our target is to actually achieve the lowest, either lowest input mix or the highest output mix given their inputs. Hence, the models are largely conceptualized as input or output oriented. Either our focus is to minimize input or our focus is to maximize output. Second, each organization is assigned an efficiency score by comparing its output to input ratio. So, to that of efficient organization that form a piecewise linear envelope of surfaces in multidimensional space. So, basically we are linear enveloping those organizations which are away from the distance function or the radial distance and how far a score is defined and can be interpreted. Let us stick to input oriented efficiency. We will clarify one by one with right example and its diagram. Suppose a DMU uses two inputs x1 and x2 to produce a single output, that is y. In healthcare setting, maybe a hospital using two inputs such as doctors and nurses to produce single output, that is patient's treatment. Okay. Assuming diminishing marginal factor productivity, isoquants can be constructed that those will be of course convex to the origin. Now, along the frontier reduce use of one input, say X1, that is doctor, or maybe another input, that is nurses, necessitate an increase in the use of other input, that is X2 nurses, to maintain the level of treatment provided. So, if we are actually reducing one, we may have to increase another one in order to achieve the target output, that is Y, that is treatment. Okay. So, this is what is given. Hence, a curve, that is we are deriving a production possibility possibility through isoquant, since we are actually plotting it through the inputs, two inputs. Hence, our maximum possible bundles are presented through Z Z prime. So, here it is, this is Z Z prime, and this is convex to the origin, since we are diminishing marginal productivity is followed. All DMUs lie on the production frontier if they are actually efficient, or above it if they are inefficient. Okay. If even higher cost is actually required to produce, then of course that is not considered to be efficient. So, we will be actually emphasizing technical as well as allocative efficiency one by one. At this time, we are discussing hospital A could proportionately or proportionally reduce its use of doctors and nurses given the amount of treatment it provides, move to a feasible and technically efficient production point such that adopted by hospital B. So, there are DME units basically A, B, C are presented in this case A, B, C. You can just have a look. Here are the units. We will be comparing and explaining the possibilities. SS SS prime is a budget line or the ISO cost line, which reflects the ratio prices of the inputs, and that when we are taking actually ratio of the prices, we are actually supposed to take up the discussion of allocative efficiency, since the prices of inputs are derived, then the best use of inputs or the allocation of them is actually a matter of concern for the industry or for the organizations. Hence, allocative efficiency will be discussed. At this stage, we are actually sticking to the output given input. We are trying to reach at the boundary line, maybe through combination of input to output, or combination of output to the minimum level of input. We will be emphasizing in a short while. The cost efficient point of production is in this case is actually B prime, since that is tangential, and we have already read in our microeconomic theory that when it is tangential, the budget line is tangential to that of the isoquant, and or the cost line is tangential to the cost line. S prime is cost line. We reach at the optimum level of the production, okay, or the cost effective point of production. Okay. So, hence in that case hospital A's production is currently above much above the production frontier, which is inefficient. That is, more inputs are required to produce the output of at point A. It is actually inefficient, it is much above in the radiant. You can just check a radiant, you can just have a check that it is much above to achieve, and so more inputs are required to produce the output at A than if it were to move to a point such as B or B prime. So, let us see, in DA technical inefficiency is usually measured using the radial measure of inefficiency by comparing where the hospital is in relation to the production function, that is the distance of B to A. This distance is actually unnecessarily over expensive, or over inputs are required to get the treatment. Treatment actually lies with the Z and Z prime production possibility or the isoquant, where the output target is actually, if you remember our example, X1, X2 and Y. So, Y is actually required, B to A is inefficiently used, that has to be controlled. Okay. So, the distance BA, that is the amount by which all inputs of doctors and nurses could be proportionally reduced without a reduction in hospital admission. So, this one could be proportionally reduced to this level, hence we can reach at an optimal point. This is expressed in percentage term by the BA by OA, BA by OA. This is basically inefficient proportion. This proportion out of the total its combinations of input and output, this distance could be actually minimized, and hence it is actually called. So, then how to measure technical efficiency in this case? That is input oriented model we have been emphasizing. So, in this case for hospital A, we have to define that OB out of OB by OA. OB is actually the optimum one so far as the isoquant is concerned, and OA is its own allocation of factors. Hence, it is the technical efficiency through input oriented model of hospital A is defined as OB upon OA. This is also equal to 1 minus inefficient technical efficiency, that is BA by OA. 1 minus BA by BA is the inefficient allocation. So, if that extent is minimized, will be actually useful. Then what do you mean by pure technical efficiency? This shows the deviation from the production frontier, that is Z prime, and this value lies between 0 and 1, and if 1 by any deviation, if we are achieving its value lies between 0 and 1, if it is 1, that means full technical efficiency is achieved. If hospital A produce at a point such as B, once the B level is achieved, that means full technical efficiency is actually achieved. Okay. Then if the ISO cost can be specified, ISO cost, because the input prices are known, then that way when ISO cost, if we can define very clearly, here it is S prime. If that is very clearly defined and then the respective prices of x1 and x2 is clearly identified, in that case we are actually referring to allocative efficiency, and in short it is called allocative efficiency through input oriented model. So far we have been discussing technical efficiency, you can just have a mark, we have been discussing technical efficiency. Now, when we are responding through the best possible choice is through the inputs and their cost functions, then we will be emphasizing their allocative efficiency. Now, in this case of the operator, if the hospital, we are referring to the hospital A or the DME unit A, we are referring to point A as follow. So, allocative efficiency through input output oriented model is OC upon OB. So, if cost is known for this particular case, so the ratio would be actually OC by OB. The optimum one of course will be at B, who have to reach B, hence the allocative one has to be OC, where the distance CB is the reduction in production cost. That would actually require this reduction is actually is considered to be good. Is the reduction in production cost that would occur if production were to take place allocatively and technically. So, allocatively efficient point, that is B prime. So, since at B prime we have already seen that at B prime and at C the cost levels are same, okay, they are on the same ISO cost line, and the maximum production is also achieved. Hence, the distance CB is the reduction in the production cost that would occur if production were to take place at allocatively efficient point, that is B prime, instead of the technically efficient point, but allocatively efficient point, that is point B. Okay. So, I will further clarify, it thus represents the deviation from the price efficient point. So, we are now actually defining the price efficient point than that of the production efficient point. The extent to which DMU incurs expenditure more than the minimum feasible one, therefore comprises two components. One is called technical efficiency, another is called allocative efficiency. We have already clarified. The production of these measures can be combined together, that is basically called total economic efficiency, in short called EE, input oriented. that is economic efficiency, total economic efficiency input oriented model, that will be simply multiplication of technical efficiency input oriented and allocative efficiency input oriented. So, in the case of this technical efficiency, we have already defined as OB divided by OA, here is the point OB divided by OA. Then in case of allocative one, OC divided by OB, OC divided by OB. So, finally, this is derived as OC divided by OA. So, economic efficient allocation would be efficiency combination will be OC upon OA. So, similarly, for all DMUs we can able to easily calculate their possibilities, and then we can compare which one is really efficient. Now, another is called output oriented. So far we have been emphasizing what is called input oriented model. When the focus is on output oriented, of course, the target is actually output oriented. So, in that case if there are two outputs, then our two outputs, then how best output to be utilized, so that it will be efficient. In this case, example you have taken as inpatient treatments and outpatient visits. There are two outputs for a single input, that is hospital staff. Given the hospital staff, how best we can allocate inpatient treatment and outpatient visits, so that our model is considered to be efficient. So, once again here it is ZZ prime is called production possibility frontier. Why it is called production possibility frontier? Because we have taken with respect to the output. In the earlier case it was with respect to inputs. So, isoquant was derived, now it is production possibility frontier. So, all hospitals lie on the production frontier if they are efficient or below it. If they are below, then of course they are inefficient. Using the output orientation, hospitals which lie below the production frontier, that is A, in this case hospital A, okay, could proportionally expand their output quantities, or basically Y1 and Y2 of inpatient treatment and outpatient visits. The holding level of input use, that is X, or that is hospital staff constant. Given the constant level of this, they can actually increase proportionately. Under the existing technology, they could do this up to a point such as B, that might rise to this level, which is located on the production boundary. If information about relative value of two outputs available, then we can also discuss the possible constructs to construct the or possible to construct the equivalent of an ISO revenue line. So, that is also possible. So, SS prime in fact is our the line ISO revenue curve reflects the market value of the two outputs, that is Y1 and Y2, usually that is called price line or the contract curve. The efficient point of production is in fact B prime, which is highlighted over here, okay, on the tangential point between ISO revenue and the production possibility frontier. And the technical efficiency in this case in the output oriented model, hence we have written as technical efficiency as output oriented of hospital A is of course OA by OB, as simple as that, OA by OB. Okay. Whereas the allocative efficiency, which is did, now it is just the reverse, we are actually sticking to output oriented model, hence the ratio would be accordingly taken. So, that is in fact OB for the technical efficiency one, OB by OC. Our focus is actually on the ISO revenue line, and that revenue has to be attended. So, OB upon OC is the allocative efficiency in output oriented model. Okay. Hence, the total economic efficiency can also be calculated by multiplying these two, and finally, it is resulted as OA upon OA, that upon OC. So, this is indeed called the total economic efficiency. In healthcare, output prices seldom available, and so most studies restrict the analysis to the calculation of technical efficiency. Since the output prices are hardly available and hence not the total economic efficiency is very difficult to calculate in healthcare research. So, technical efficiency is mostly restricted in research. All these measures of efficiency, that is technical, allocative and economic efficiency, are bounded by 0 and 1. We will discuss this value by in our calculation through the right software. We will be using deep software as well. And that is open access software. These radial efficiency measures are units invariant. Okay. So, this is scaled down in their variables and hence those values are considered to be comparable. So, these are all so far as different calculation of technical efficiency, allocative efficiency, both in input oriented model and output oriented model concerned. I think you will get the applied version in our subsequent lecture, and these are our further readings. I am suggesting you to read for further clarifications, and in the next lecture we will be emphasizing on variable returns to scale model and constant returns to scale. We will also compare constant returns to scale model versus variable returns to scale model, that is in short called CCR and BCC model in DA framework, and scale efficiency, and also we will deal with some slacks, how slacks are defined. With this I will stop here. I look forward to your participation. Thank you.